Good evening and welcome to the UP Community Health Town Hall program. Tonight's program is being hosted by the Center for Rural Health at Northern Michigan University. My name is Elise Burr and I'm the director of the center. The program has been organized in partnership with Dr. Kelly Kam, epidemiologist and assistant professor in the Department of Kinesiology and Integrative Physiology at Michigan Technological University. This evening's program is sponsored by the Michigan Center for Rural Health, and we're appreciative of their funding generosity and the connections they've provided with some of our expert guest panelists this evening. And so tonight's topic is actually going to talk about chronic kidney disease, which is very prevalent in our area of the state. And I'd like to welcome this evening's guests, our expert panelists, are Dr. Rachel Perlman. She is in internal medicine and a nephrologist with Michigan Medicine out of Ann Arbor. Welcome, Dr. Perlman. We also have Taylor Paul, a registered dietitian and nutritionist at UP Health System Portage up in Hancock. Welcome, Taylor. And Terry Walters, program specialist with the National Kidney Foundation of Michigan. We feel really fortunate to have all the experts here tonight and really look forward to sharing the information with our communities up here tonight. So thank you for making time for this evening's program. And we'll start off with Kelly Kam sharing some statistical information with us. Thanks, Kelly.
Thanks for having me again. So I realized as I was thinking about some of the students who may be listening in, as well as just anybody looking for more information on any of the topics that we cover, that might be useful for you to know where I'm getting all of this information, because I'm not an expert in any of these topics that we have, but finding the information to share with everyone. So this information is primarily coming from the Centers for Disease Control. There actually is a program called the Kidney Disease Surveillance System. And then I'm also drawing data from different sources within the CDC, oftentimes looking at places like the Kidney Foundation for additional information, although oftentimes their information is drawing from CDC, and the CDC information comes from state level information. So if anybody's ever interested in being able to look a little bit further into the details, it's often there in a very readable format. So as Elise mentioned, kidney disease absolutely is a public health problem. It's a very common issue across the United States. So national numbers, we're looking at over 35 million people who have chronic kidney disease in the United States, which is about 14% of our population, or about 1 in 7 adults. Prevalence, or how many people have this disease, does increase with age. So younger adults in that 18 to 44-year-old age range, about 6%, so still a pretty high number, who have chronic kidney disease, but going up as much as 34% for our older adults that are 65 and older. So 1 in 3 of those older adults have kidney disease. As far as people who have the issue, slightly more women than men, but not a real big difference on that. There are racial inequities. So non-Hispanic Black adults are much more likely to have chronic kidney disease than other racial groups. And again, this is nationwide. So some of our speakers tonight are going to be talking about Michigan specifically and the Upper Peninsula. So the data can shift a little bit, but nationwide, non-Hispanic Black adults are much more likely to have chronic kidney disease. Risk factors for chronic kidney disease, diabetes is the leading risk factor. And almost 40% of people with diabetes have chronic kidney disease in a recent nationwide survey. When we look at that, what that means in the UP, 10 to 12% of the adult population in the UP has diabetes. So if we look at that, that's a pretty big number that potentially could have chronic kidney disease. And high blood pressure is the other really big risk factor. And among the people who have high blood pressure, about 1 in 5 to 1 in 4, somewhere between there, of those people also have kidney disease. And so when we look again at the UP, looking at that risk factor of high blood pressure, more than a third of the adults in the Upper Peninsula have ever been told they have high blood pressure. So that's a pretty big number when you think about those as risk factors. The other thing that's a really important thing in terms of public health is that only about 25% of the people who have chronic kidney disease are aware of the fact that they have it. And so that lack of awareness can lead to all kinds of issues in terms of lack of treatment, delays in treatment, and delays in being able to do what needs to be done to slow progression, or at least find out and get it treated early, which again, many of our speakers tonight will speak on. When we look at, so we have a lot of people who have this. Well, what does that mean? There are significant adverse health outcomes, one of which is early death. And nephritis, nephrotic syndrome, and nephrosis, which include chronic kidney disease, is the 9th leading cause of death in the United States. And it has been in the top 10 leading causes of death for decades. So it's really kind of hung around at that 8, 9 leading cause of death. So this is a major problem. It's about, right now, it's about 2% of all of the deaths in the United States are due to these kidney diseases. And it does differ by race. So risk of death is higher among Black and Native Hawaiian and Pacific Islanders. So among those populations, kidney disease is about 2.3% of all deaths in those racial groups. And that is significantly higher than white individuals. The other thing is there are differences by state, which again, some of our speakers are going to speak on tonight. But really that, it's still hanging out. We think about the top 3 as the big, killers in the United States of cancer and heart disease. But this is a really big issue that we need to speak on and we need to think about. So with that being said, I'm going to introduce Dr. Rachel Perlman, who's an internal medicine nephrologist at Michigan Medicine. And Dr. Perlman's going to explain chronic kidney disease, what it is, what that means, how it develops, and the various stages of chronic kidney disease. So I'd like to welcome Dr. Perlman.
Hi, thank you so much for that nice introduction. And I'm really excited to be here this evening with you. Elise, thanks for inviting me, and thanks for all of you for hosting me and putting on this platform and including chronic kidney disease in your topic list. And I really want to thank everybody who is listening for spending some time learning about your kidneys and what to look out for and what you can do to keep them healthy. The kidneys don't have the same kind of public relations or being well known in our consciousness. And so I think a lot of people are much more aware of other organs than their kidneys and don't really think about their kidneys if there isn't a problem. And so I'm going to start with talking a little bit about what kidneys do when things are working well, so that we can talk a little bit more clearly about what can go wrong. So first of all, most people are born with 2 kidneys. And if you've met somebody or know somebody who's given up a kidney, either because of trauma or surgery to remove it, or has donated it to somebody who needed it, we have some built-in extra kidney function, partly by having 2 kidneys. And so we have some wiggle room in the available kidney function that we have as we try and protect what we have. Your kidneys are about the size of your fist, if you make a tight fist, and if you put your hands on your back right below where your ribs end, that's where your kidneys sit, but they're deep, both from the front and the back. So you usually can't feel your kidneys, and your kidneys don't usually hurt. And chronic kidney disease is usually painless from a kidney point of view. So there are, of course, exceptions to that rule, but most people who have back pain don't have kidney disease. They have back pain because that's another common problem. So the kidneys make urine, but that is a kind of complicated and remarkable process. And the kidney is divided into hundreds of thousands of little functional units called the glomerulus. And each one of these is like a little bitty filter that the blood passes through. And urine is made at that little filter level. And so urine is the extra fluid that is filtered out of the blood. So urine removes extra fluid, and the waste products that we make just from being alive and having our bodies eating and metabolizing, those waste products are removed in the urine. The kidneys also regulate electrolytes or blood chemistries and help control blood pressure. They also have some hormonal functions. And as they're doing these functions of removing waste products or removing products that we don't need, they're also keeping what your body needs inside the blood. So blood cells aren't passing out into your urine, and protein, except for a tiny little bit, isn't passing out into your urine. They're keeping the nutrients and cells that belong in your blood, and letting the waste products be removed. And we think about the rate at which the kidneys are able to remove these waste products as a filtration rate. And so this is often called the glomerular filtration rate, or sometimes you'll see it written for short as GFR. And the reason I want to highlight this is how we measure kidney function. And so if you've had blood tests to check your kidney function, you'll get a report of your GFR, or glomerular filtration rate. And that's part of what we'll focus on for chronic kidney disease. So in terms of defining chronic kidney disease, I want to pause to separate it from the kind of kidney disease that people get when they're sick. And if you're unlucky to be in the hospital with a really serious infection or a major surgery, sometimes people have kidney injury surrounding that has a really good ability to recover in the short term. And we call that acute kidney injury because it usually comes on all at once. It goes along with being acutely or seriously ill. And chronic kidney disease is different because it's an ongoing medical condition. And there's a pretty formal definition of what this means. And so it's an alteration or a problem with your kidney function that's been going on for at least 3 months. And that's usually seen as either a decrease of kidney function based on your lab tests, but it can also be other markers of kidney damage, like too much protein in your urine or structural damage to your kidneys, which can be seen on medical imaging tests like an ultrasound or occasionally a kidney biopsy. So we look for markers of kidney distress or kidney damage, both in the blood and possibly in other ways. Not just possibly, actually, hopefully, because it's really important to look at these other ways also. And kidney disease is divided into 5 stages, which represent less to more severe disease. So in stage 1 and stage 2 kidney disease or chronic kidney disease, people have normal or near normal glomerular filtration or kidney function. And in stage 3 kidney disease, they have mildly to moderately reduced kidney function in terms of this filtration. And then in stage 4 kidney disease, the kidney function is significantly reduced. And stage 5 chronic kidney disease is the most severe form. This is a time when people are often having symptoms of kidney disease and preparing for kidney replacement therapy, which is either dialysis or a kidney transplant. And I want to squeeze in that in addition to kidney disease, our kidney function goes down naturally with age. And so that isn't necessarily the result of a disease or causing people physiologic problems or symptoms. But as we get older, parts of our body change, and your kidney function is never better than when you're about 30. And after that, we all, even if we're healthy, lose a little bit of kidney function every year. And so older people are more vulnerable to kidney disease, but they can also have some age-related mild decreases in their kidney function. So one big question is, how do I know if I have kidney disease? like Kelly said, if this is a really common problem, how do you know if you have it? Well, the most common way that people know is through blood tests. And the number one blood test to measure kidney function is called creatinine. And this is a widely available test. And the creatinine number from your blood is then plugged into an equation which gives your glomerular filtration rate, because your glomerular filtration rate will vary a little bit based on your gender and your age for the same number of creatinine. And so it is more accurate in diagnosing chronic kidney disease, not just to look at the creatinine, but to put it into this formula or equation for GFR. Many labs will give this to you automatically as part of your lab report. But if your lab doesn't do that and you have a number for your creatinine from a blood test, you can, through the National Kidney Foundation or many other websites, type in your creatinine from your blood test and either your age or your birthday and your gender, and that will give you a GFR or give you your estimated GFR. There's another blood test that's used to measure GFR or kidney function, but it's not used as often, and it's called cystatin C. And that's just not as widely available or commonly used in this country, but sometimes it's useful, especially for people who either have a really way more than average muscle mass or way less than average muscle mass. It can be a really useful test in that situation. The other test that's really important for looking for chronic kidney disease is a urine test for protein. And unfortunately, this isn't done as often as it should be. And that's a problem throughout the state and throughout the country, because looking for extra protein in the urine is one way of seeing whether the kidneys are under stress or distress. And so that's also an easy test to have done. You provide a small urine sample in a lab collection cup, and the lab measures how much protein is in your urine, and it should just be a teeny tiny amount, because your kidney should be holding on to most of the protein that passes through. Occasionally, other blood tests and other urine tests are used, or people have pictures of their kidney through ultrasound or CAT scan. But the testing for creatinine and protein in the urine are really the most common and most important ways of looking for chronic kidney disease. I want to talk a little bit about what causes kidney disease. And this ties in with to what Dr. Kam said, but I'm going to go into a little bit more detail. So diabetes is the #1 cause of kidney disease in Michigan, in the US, worldwide. And high blood pressure and other vascular diseases are also super important and the #2 cause of chronic kidney disease. Other things that cause chronic kidney disease are autoimmune diseases where the body attacks itself. Probably the most common example of that is lupus. There are a few genetic diseases, a handful of genetic diseases that cause chronic kidney disease. The most common one is polycystic kidney disease, where the kidneys are literally replaced by dozens and dozens of cysts, so it makes it difficult for them to have enough kidney mass to do their own job. Some environmental exposures can cause chronic kidney disease, and some medications, both prescription and non-prescription, can cause chronic kidney disease. So then the question is, who should get tested for chronic kidney disease? And in this country, we don't have a national recommendation to test all adults over a certain age, and that might change, but right now screening really focuses on testing people who are at risk. And so the common risk factors, I'm gonna say some of them, because if they apply to you, these are a reason to get tested, and a reason to please say to your doctor, I heard you should be testing my urine also. What do you think of that? Because you really want the paired testing of your blood and your urine. So people with diabetes, people with high blood pressure, people with autoimmune disease, people who have many kidney stones or many bladder infections, people with certain kinds of cancer, people with some infections like hepatitis B and hepatitis C and human immunodeficiency virus are all have an increased risk of kidney disease. People with sickle cell disease or trait, which affects red blood cells, are at increased risk. Anybody who has a blood relative with kidney disease should get tested, because even if there isn't a clear genetic cause where we know the gene that causes it, like polycystic kidney disease can cluster in families. And so just knowing that you're related to somebody with kidney disease is a good reason to get tested. Plus, kidney disease is not spread out equally across the country. And so people who are at increased risk based on their ethnicity, I really recommend testing for people who are Native American, Latino, Black or African American, Asian Pacific Islanders. These are people who are, regardless of how well they take care of themselves, at increased risk for kidney disease or severe kidney disease. People who take frequently medications like Motrin, ibuprofen, and Aleve, these are all in the same drug category, and they can be hard on the kidneys. And anybody who had an event where their kidneys were acutely or suddenly injured when they were sick at another time should get tested down the road to make sure that their kidneys have fully recovered, because you're still at risk from that episode. So part of the reason that I think getting tested is so important is because it can be part of what makes you want to make the effort to keep your kidneys healthy. But the things that are healthy for your kidneys are sort of healthy for your whole body. And so I'm going to talk about what to do to keep your kidneys healthy, regardless of whether you have kidney disease. The number one thing is stop smoking if you're a smoker. Don't start if you're not a smoker. I think most people know that smoking is bad for your heart and your lungs, but it's bad for your kidneys too. So that's a special reason to quit. People with diabetes and high blood pressure, you want to make sure that these are really well treated and under very good control. And for people with diabetes and high blood pressure both, over the past couple of years, we have new drugs that aren't brand new and so new that you don't want to be using them, but have become really well established at being protective of kidney disease. And so if you know you have kidney disease and diabetes or high blood pressure or both, I think it's totally worth asking your doctor, am I on medication that's also protecting my kidneys? Because we know more now than we did a decade ago about which medications help protect the kidneys from the effects of these other problems. If you have another underlying condition or medical problem that is causing your kidney disease, you want to make sure that that's well treated too. For many adults with chronic kidney disease, cholesterol medication ends up being an important part of caring for their kidneys and every blood vessel in their body. Avoiding medication like Motrin, ibuprofen, and Aleve, because that's hard on your kidneys, especially if you have kidney disease. Exercise is really important, not even specifically for the kidneys, but for every blood vessel in your body. And the kidneys depend so much on getting a lot of blood flow every minute of every day. And nutrition is really important, both for protecting your kidneys and specific patterns of eating for people who have more advanced chronic kidney disease. And so I am really thrilled that part of tonight's panel includes a dietitian. And Elise, thanks. I think I'll leave off there and see if you have any questions for me.
Actually, listening to you talk a little bit about the urine tests and the importance of that, that kind of sparks the question of, do you think there is or will be any kind of movement for at-home urine tests to increase screening?
I think that's a really interesting question. And screening at home is so appealing because you don't have to go out and do anything, but a test needs to be validated for home use. And so before people had the ability to check their blood sugar with a finger stick at home, They could check it with a urine test for high sugar. And it is possible to do this testing at home, but right now it's not widespread. And so I
Okay.
guess that was a long way of saying, I don't know,
Yeah,
but
yeah,
it's
yeah.
appealing.
Yeah. I mean, what we did before Cologuard showed up, So, I mean, there's always things being developed and kind of implemented into developments. Are you seeing any kind of trending with chronic kidney disease in the nation? Are we getting better? Are we staying the same?
Yeah, chronic kidney disease has gone up. And what I will say is that most people who have chronic kidney disease are in the earlier stages. And so there's always concern, and the goal is to keep those early stages from getting worse and progressing to more advanced or more severe kidney disease. But as our population ages, and as more people have more years of diabetes and high blood pressure, yes, there's been an increase in chronic kidney disease.
A question, Dr. Perlman, thinking about the new movement with some of the weight loss drugs, those injectable weight loss drugs that are being used, and some of the evidence that's coming out on the benefits, long-term benefits of those drugs. Given the risk factors are similar with all this, has there been, to your knowledge, has there been information about whether these drugs also have benefits to kidney disease?
Yeah, that's a great question. And there's definitely significant overlap between the drugs that are used to treat diabetes, which is where these weight loss drugs were developed, and helping prevent the progression of kidney disease. And although we're really focusing on kidney disease here, kidney disease and heart disease overlap a lot. And so some of these diabetes drugs are especially exciting because they help protect people from heart disease and kidney disease simultaneously. And so that's a big win. And these effects seem to go significantly beyond just weight loss, which is really interesting. There's a class of drugs called SGLT2 inhibitors, which is kind of a long name, but they are one of the drugs used to treat diabetes. And those have been shown to be really very protective for people with kidney disease. And so that actually is something that's encouraging to people who treat chronic kidney disease.
Dr. Perlman, I mean, we know that prediabetes can be somewhat reversible if people lose weight and eat healthier and exercise. Is chronic kidney disease reversible? Is that something that you can improve or fall out of?
That's a good question. And the answer is a little bit complicated because some is reversible, and you'll hear about people, or there'll be a story about somebody whose chronic kidney disease completely reversed. When people have protein in their urine, but their kidney function in terms of that glomerular filtration is normal, that protein in their urine can improve or be reversed. But what I think is really important with chronic kidney disease, even more than is it reversible, is how much can you slow the progression? Because if you have a really early stage of chronic kidney disease and become aware of it and are treating it and taking good care of it, yes, reversible would be fabulous, but we get older and we acquire medical problems. And so even if it's not reversible, if you can keep it stable or either prevent progression or slow the progression, that's so valuable that I hate to lose sight of the absolute value of that for so many more people than reversibility exists for.
Yeah, I think that's really important for listeners and viewers to understand, because so many times people will say, well, that's it, I've got it, and just accept it and not change anything. And so I think that's really great advice for people to be aware of. Is there any place you recommend that people go to learn more information?
Yeah, there are a couple of sites that I especially like. And I will say, like, full disclosure, I volunteer for the National Kidney Foundation of Michigan, and I volunteer with the American Kidney Fund. But those are my two favorite places to look for information about kidney disease, because they're really well balanced and accurate, and serious, but not alarmist. And so I recommend those both highly.
Wonderful. Thank you so much. Lots of
thank
great
you.
information. And I'm sure there's going to be a lot of takeaways from tonight's program. So for listeners just joining us, this is the UP Community Health Town Hall program. And tonight's topic is discussing chronic kidney disease with our expert guest panelist, Dr. Rachel Perlman, internal medicine nephrologist from Michigan Medicine, Taylor Paul, who's our registered dietitian with UP Health System Portage in Hancock, and Terry Walters, program specialist for the National Kidney Foundation. And next, we'd like to introduce Taylor Paul. She's going to talk a little bit about the role that diet plays in relation to chronic kidney disease. She'll talk about how the foods we eat every day impact our health and the nutritional considerations in managing the various stages of chronic kidney disease. So welcome to the program, Taylor.
Hi, thanks for having me. And thank you, Dr. Perlman, for starting us off so strong and explaining a lot about kidney disease and a lot of different factors that go into that. One thing Dr. Perlman mentioned is good nutrition plays a role in staying away from kidney disease and also managing the disease, kidney disease. And what I want to talk about a little bit today is good nutrition and what does that look like? So good nutrition, why is it important for individuals with kidney disease or trying to prevent kidney disease is, one, good nutrition will give us energy to do our everyday tasks. It will also help us prevent infection. It will help us avoid muscle mass loss, which is important too. It'll help us maintain a healthy weight and even, like Dr. Perlman mentioned, slow down the progression of kidney disease. So I share that because nutrition is not a one-size-fits-all approach. And even two individuals with kidney disease, their nutrition may look different, and it's supposed to. It's not a one-size-fits-all. And what I want to share is as a dietitian at the hospital, I see individuals early on in the stages of chronic kidney disease, as well as I see individuals on dialysis with kidney failure. And I like to mention why good nutrition is important in kidney disease is because I see a lot of people get fearful of food because they're afraid that this is going to harm their kidneys or this is going to worsen their kidneys. And oftentimes that sometimes leads to not eating enough, which is not our friend as we age and as we try to delay the progression of the kidney disease. So that's something I like to mention, that good nutrition not alone isn't eat this, not that, it's eating enough. That's just as important as what we're choosing to put on our table as well. I want to mention that proper nutrition for kidney disease, there's certain nutrients that we may need to control considering the kidney disease. Some of these include protein, which Dr. Perlman talked a little bit about, sodium, potassium, phosphorus, and calcium. So these are specific nutrients that kind of correspond with kidney disease, and eating the right amount of these may control the buildup of waste and fluid in our blood. So that means when we control these certain nutrients, that won't put as much hard work on our kidneys, depending on where we are, to remove that extra waste. So if you're wondering how much you should be eating of what or what way to go, I encourage you to reach out to your kidney doctor or primary care provider or even your kidney dietitian to see if you should or should not be restricting some of these nutrients. Because like I said, there's not a one-size-fits-all approach. There may be one person with kidney disease that may need to limit the amount of potassium in the diet. There may be another person who they don't have to limit the potassium in their diet. So it is a little bit complicated, but at the end of the day, I have 3 tips that I want to encourage individuals to take home. So if you don't, from the nutrition piece of this, 3 takeaways that I want you to think about whether you're trying to prevent kidney disease or slow the progression. Number 1, is try to cook at home more. Cooking at home is a great skill for managing your health. And when we cook at home a little bit more, we're eating out a little bit less, and we're controlling what we're putting in our food. So when we eat out, we don't know exactly what's in our food. And generally, when we eat out, we're more than likely consuming a lot of sodium and phosphorus specifically. Remember, those are two of the nutrients that sometimes we may need to control with kidney disease. So when I say cook at home, I don't mean you need to learn how to do a big, complex, elaborate meal, because a lot of the time, specifically our Upper Peninsula population, we're cooking for one person. There are ways to cook at home and still utilize and make it easy, a simple meal. A couple of resources that I encourage people to go to when you're looking for a quick, simple meal to cook at home. MyPlate.gov is a great website for simplicity. There's a lot of recipes that encourage cooking at home and make it really easy, and there are even suggestions of what to do with leftovers. So that's my number one tip. Just try to cook at home a little bit more. And honestly, whether Dr. Perlman talked a little bit about high blood pressure, diabetes, kidney disease, cooking at home is all ultimately going to help all of those. So it helps manage all of our chronic conditions, not necessarily just the kidney disease. Suggestion, or my tip number 2, is to eat regular meals and snacks throughout the day. I say this because I see a commonality that as Americans, we tend to wake up, maybe drink coffee, or we go all day and eat a really big meal at the end of the day. Eating one big meal at the end of the day is really hard on our organs, specifically our kidneys, our pancreas. It's, especially if our body isn't working as good as it once was, it makes it a little bit more difficult. Eating regular, small, frequent meals throughout the day says, our body says, okay, let's do this, let's go, I got this. And it's a little bit easier to keep up with the metabolism, and your organs can work a little bit better rather than eating one really large meal. So that is often something that I see a lot, specifically in our population. So try to work on those small, frequent meals throughout the day. Tip number 3, this one's my favorite one. Making diet changes is hard. So my tip number 3 is when we're making lifestyle changes, diet changes, think about what we can do more of instead of trying to take away. Let me tell you an example. Say we're making a diet change. We really want to work on a nutrition, which is hard, and it's okay to ask for help. Instead of saying, I'm done with ice cream. No more ice cream for the rest of the year. I want you to change your mentality a little bit. What can I add more of to help control my ice cream? For example, I'm going to eat a serving of vegetables with my dinner at least 4 nights a week. It's training your brain, okay, I'm going to add more to my diet. And by doing that, you probably are less likely to eat either a smaller amount or less ice cream because you're adding more fiber, more vegetables, more nutritious foods to your diet. So number 3 is when you're making diet changes, think about what you can add, not take away, because there's a mental game a part of that as well. If we are trying to restrict something, we're going to often think about it, right? Think about to add more. That's a key that I recommend my patients and clients when they're trying to make changes. And those are my 3 takeaways to help follow good nutrition. One thing I also want to touch base on a little bit is talking about fluid. So Dr. Perlman talked a little bit about what our kidneys do for us. And sometimes fluid intake is something we need to be mindful of, since our kidneys do manage and maintain the fluid levels in our body. Generally, in the early stages of chronic kidney disease, we don't need to limit the amount of fluid that we're taking in. It's more likely in the later stages that your doctor, your kidney doctor specifically, like Dr. Perlman, would recommend you to limit your fluid. To give you a rule of thumb, so for our general population and for those in the early stages of kidney disease, maybe we want you just to stay hydrated. And for a rule of thumb, I say 64 ounces, which is also equivalent to about 8 cups per day. To give you a number, how much do I need to drink to stay hydrated? So like I had mentioned, in those later stages, sometimes we do recommend fluid restrictions. And I want to share that often things that are missed that I find when I see clients come through my office is they're eating a lot of things that are counted as fluid, which may put them in that fluid overload in a sense. So for example, some of the things that would contribute as a fluid part of the diet would be our liquids that we drink, like water, coffee, pop, juice, all of that. Another food item that is considered a liquid would be things like Jell-O, ice cream, popsicles, soup. Those all contribute to the fluid intake. That's often something missed when I'm talking about fluid restrictions. And like I said, if you are concerned that you may need to be on a fluid restriction or you want to talk to your kidney doctor about it, I encourage you to reach out to them and they'll guide you appropriately if you should or should not be on a fluid restriction. But something to keep in mind for the later stages of kidney disease, sometimes that's appropriate. And those are some of the foods to also look at when we're looking at fluid in the diet.
Taylor, can you tell us a little bit about whether or not people with chronic kidney disease should be taking vitamins or mineral supplements?
That's a good question. So nutritional supplements are given to patients with kidney disease in a very careful manner. We look at blood work, urine testing, physical examinations to determine if whether or not someone's getting enough nutrients and may need to be on a supplement or vitamin supplement, mineral supplement. I want to share, I could probably talk about supplements for another hour, but I'll keep it short. So the supplement market is a multi-million-dollar business, and there are a lot of products out there. So as a registered dietitian, my philosophy when it comes to supplements specifically, try food first. That is a huge philosophy of mine that I highly encourage, because more than likely the food we're bringing in is probably going to be less expensive than all these products we're trying to buy. Another thing to keep in mind is when we're taking vitamin and mineral supplements, please tell your doctor. And the reason for that is there's a lot of things we're taking that could be harming our kidneys, especially if we have kidney disease or a genetic history of kidney disease, X, Y, and Z. So I encourage you to make sure your doctor, your kidney doctor are all aware of what kind of vitamins and minerals you're taking, because it could be harmful to those kidneys. That's a really great question. And like I said, try food first. If you need guidance, please reach out to your local kidney dietitian or registered dietitian in your area so we can guide you appropriately.
And Taylor, can you give us that website one more time that you recommend for eating healthy and portion control?
Yeah, so I have two that I'll give you.
Okay.
So the first one is myplate.gov. It has great recipes, kind of breaks down the food groups, and it's a really great resource for recipes and just guidance for general nutrition health. Another one that I really love is called eatingwell.com. And the reason why I like this is because all the recipes are monitored and developed by dietitians, and there are like diet hubs. And when I say diet hubs, you could click Diabetes Diet Center and it brings you in to a diabetes diet center. You can click into a high blood pressure center. It brings you into a high blood pressure center. And these recipes are conscious to those specific diagnoses. So eatingwell.com is a great resource for recipes to help you cook at home a little bit more. Remember tip number 1. So those are two websites that I really love. I encourage people to check out and go to if you're looking for a little bit of change, but also make good, healthful food choices to give you that energy to do everything that you need to do.
Wonderful. Thank you, Taylor. Lots of great information. Appreciate your time on this. Terry Walters, you've been extremely patient with us. Thank you for being here tonight. Terry is the program specialist at the National Kidney Foundation of Michigan. She's going to tell us a little bit about the foundation, and then how efforts are coordinated between the foundation and the national level as well. So welcome to the program, Terry.
Thank you so much for having me. Great information that's been shared from Dr. Perlman and Taylor and Dr. Cam. Like I said, I'm very thankful to be here. I do want to just give a little bit of information about the National Kidney Foundation of Michigan. We were founded in 1955. And our mission is to prevent kidney disease and improve the quality of life for those people living with kidney disease throughout the state of Michigan. A couple statistics that I wanted to just kind of go through. Over 1 million adults in Michigan have chronic kidney disease. The unfortunate part is that many don't know they have it because of the symptoms don't appear until later, just like Dr. Perlman was talking about. Once again, the two biggest risk factors are for developing chronic kidney disease is diabetes and hypertension. About 64% of kidney failure is caused by high blood pressure or diabetes. Just a little bit of information about the Upper Peninsula. We have worked on a grant of Morris Hood, and through the help of the University of Michigan, we have some data from 2022. It shows that the prevalence of chronic kidney disease in the Upper Peninsula is at about 5.7%. The screening rate is about 33.2%. The highest prevalence in the Upper Peninsula is Native Americans, and the prevalence for those population is 5.9%. Just as a comparison, Michigan, the full everything in Michigan, CKD or chronic kidney disease rates are 8.2%. So that shows you how much higher it is, in that small area of the Upper Peninsula. Screening rates throughout the state of Michigan are at 24.8%. So once again, one of the things that we do at the Kidney Foundation is to try and work with health plans, health care organizations, to increase that screening for patients that are at high risk. So with the National Kidney Foundation, we have lots of programs. We strive to deliver these programs and services to people who need them the most. That would be rural areas, all sorts of different places, people who don't have transportation. We have the resource navigation is what we call it. That is a kind of a whole bunch of people that can help with getting people connected with Medicaid, that can help with, we have emergency funds for a one-time use of $200 for, let's say, utility bills if somebody's unable to pay. For co-pays, because some people will, not take their medication if they don't have the money to pay for it. So one of the ways that we do work with National is that we are helping with the National Kidney Foundation Kidney Risk Campaign. It's the 33% campaign. That is that 1 in 3 or 33% of the United States adults are at risk of kidney disease. The National Kidney Foundation does have a risk quiz that you can take to find out if you are at risk. And to take that quiz, it takes about 3 minutes, I believe. You can go to kidneymi.org/quiz. If you are at risk, and once you take the test, if you are at risk, once again, as Dr. Perlman said, ask for those 2 simple tests, the blood test and the urine test from your provider. See if they, if your risk factor is where they feel that you need to have this done. If you are at risk, there's also, you can opt in for emails that will come to you once a week that has a lot of helpful information, how to talk with your doctor, questions that you may be able to come up with or that they can help you think about so that you can ask the right questions to get those answers. All of those, the website and everything on there, we have in English, Spanish, and Arabic. The Arabic we just added about a month and a half ago. We also offer no-cost programs to support people living with kidney disease, to help prevent or manage chronic conditions for adults. High blood pressure, diabetes, kidney disease, and chronic pain. Those are all programs that we have. We have them online, we have them phone-based. The people who do the classes or the programs are actually, most of them actually are living with these chronic conditions. So it's kind of a mentor thing also that we have, just lots of different resources that can really help people understand if they're at risk, what kind of help is out there for their risk. And those classes usually are about 6 to 8 weeks long, 1 day a week. And we offer them in the mornings and in the evenings. They are evidence-based, so it's something that really can help. We also offer programs for kids. Kidney disease isn't just for adults. So we have some school-based programs that kind of look at healthy lifestyles, nutrition. One of them is Reggie's Rainbow. And Reggie is a broccoli man. And so they kind of take all of this information to the schools, the teacher, they'll go through. There's books that you can even purchase online to go through with your kids about, healthy nutrition, what foods are good for you, and kind of get them to the point where as they grow up, now they're eating a lot more healthy. And it's kind of fun for the kids, they have a little broccoli guy running around. So they also have a kids camp for chronic kidney disease for kids that have chronic kidney disease or have had a transplant. That's once a year. The nice thing is that it is a week long. At the camp, they can still have dialysis done while they're there. So these kids can actually go and have a great week, summer camp, just like everyone else, and still, be able to have that fun, even though they have this chronic disease that needs, daily medicine. One other program that we do offer, and that's the National Diabetes Prevention Program. That program is a full year, and it go through the pre-diabetes. What we are trying to do is prevent diabetes. Many insurances do cover that program. All our other ones are no cost, but the diabetes prevention program does have a cost. As a collaboration, just to let everyone know, we have worked with the Upper Peninsula Health Plan. We've done some trainings for their community health workers on screening for chronic kidney disease and just all the information that goes along with it. We have worked with the Hannah Indian Community Health and Human Services. They had 2 people just recently trained to lead one of the programs that we have of the high blood pressure control program that started for them in January. They also helped us develop the 33% materials that I just spoke about online. Also, I give a good shout out to the Michigan Center for Rural Health, not only for helping with this program, but we work with them. We do a monthly grand rounds with them for all their providers, trying to, go through and talk about the screening, making sure that we get, the blood work, the urine. We go through, we have a dietitian that goes on and does an hour presentation on, nutrition, things like that. So every one of the three that I've just talked about, they all share our 33% materials to spread the word about kidney disease in the Upper Peninsula.
Terry, can you say, is there anything that people can do to support the National Kidney Foundation of Michigan?
Yep, they can go to nkfm.org and there you can donate. That's all on there. And not to mention, while you're there, if somebody wants to donate, take a look around at some of the materials that we have that we share with everyone. Everything on there is shareable. You can use it. It's really there as a resource to help people help manage any chronic conditions, especially the chronic kidney disease.
Wonderful. Is there anything else that you'd like to share with everyone before we have our close up?
I just wanted to reiterate on the online quiz, the 33%, to make sure that people have that website if they'd like to go on and take the test. It's kidneymi.org/quiz.
Great. Thank you. All of you have provided so much information, just a wealth of information and resources. And I'm really looking forward to actually going to some of the sites that you've mentioned tonight to check out some of the information that's being made available to everyone. I'd like to thank our expert guest panelists this evening in talking about chronic kidney disease. Dr. Rachel Perlman, internal medicine nephrologist from Michigan Medicine. We also had Taylor Paul, registered dietitian for UP Health System Portage and Hancock, and Terry Walters, program specialist for the National Kidney Foundation of Michigan. I'd also like to give another thank you to the Michigan Center for Rural Health for sponsoring tonight's program. Always great to be collaborating with them on different initiatives and bringing educational opportunities to the Upper Peninsula. And lastly, I would just like to let everyone know that we are going to be taking a summer break from the regular monthly town hall program, and Kelly and I will resume the program in September. So we wish everyone well. We hope that everybody has a great summer, and we'll look forward to getting tonight's program posted on our website probably early next week. So thank you, everyone.